Hello, everybody. My name is Rafael Diaz. I'm the licensing manager for the biopharmaceutical portfolio here at WARF.
And I'm Beth Warner, Director of Life Science Intellectual Property at WARF. And we're here to nominate Shaoqin Gong, Zach Morris, and their teams for the 2021 WARF Innovation Awards. Their combination of a nanoparticle, radiation, and an immunotherapy boosts the immune system's ability to fight cancer.
We are excited to see where this technology goes, and we congratulate the team on this accomplishment.
Hi, I'm Zach Morris. I'm an associate professor here at the University of Wisconsin in the School of Medicine and Public Health in the Department of Human Oncology. Broadly speaking, the goal we're trying to achieve is to improve the cure rates for patients who have metastatic cancers. In the clinical practice in oncology, have seen great strides in recent years in the ability to achieve sometimes long-lasting responses in patients with metastatic disease. Metastatic disease meaning a cancer that has spread throughout the body. And the area that we've made the most strides with that is in the development of immunotherapies, in particular what are called immune checkpoint inhibitors. And these are agents that basically take the brakes off of our immune system and unleash it on a patient's cancer. The bad news is that these only work for a small fraction of patients. Those patients who do benefit, who do respond, can have very durable responses, and sometimes we believe even curative outcomes from diseases that were clearly not curable in the past. But the rates at which we're achieving that are still very low. And like many in the oncology community, our hope is that we can increase the rates at which we achieve response to immunotherapies, because if we can increase the number or the fraction of patients that do respond, once we get a response, those responses can be very long lasting. So we could have a really profound impact potentially on survival of metastatic cancers. But one of the observations that's been made in the recent decade or so is that when we combine radiation with immunotherapies, at least in preclinical settings, when we target one area, that tumor may die from radiation, but it dies in a way that allows the immune system to better recognize the tumor cells that have been radiated and treated there. And when that happens, not only does the radiation then give you a local effect on the area you treated, but it also can lead to a better systemic response. What we're trying to do now is develop an agent that can be injected into that radiated tumor in order to better activate that local immune response, so that we can take that local immune effect and turn that into a systemic improved response by the patient's own immune system against their cancer.
The nanoparticle we designed for this particular application has a great potential for clinical translation. First of all, the nanoparticle formulation is simple. It only consists of 3 components: polylysine, CpG, and iron oxide nanoparticle. The fabrication process is simple and scalable. We just need to mix the 3 components together using an optimal weight ratio. Lastly, the nanoparticle is injected intratumorally. Local injection can significantly reduce the required dose and the systemic toxicity. To facilitate clinical translation, we need to develop a process to scale up the production of the nanoparticles following good manufacturing practice to ensure that the nanoparticles can be produced consistently and controlled according to quality standards.
This nanoparticle we specifically engineered with the idea that this needed to be translatable. And so the Gong lab very specifically sourced the components of this from clinically translatable materials with clear clinical track records. And so we believe that this will be a particle that we can scale readily and efficiently to take to clinic.